Question 1. A nurse is prioritizing care for 4 patients. Which patient should be assessed first? A 45-year-old with a history of asthma reporting mild shortness of breath. B. A 60-year-old with chronic hypertension experiencing a headache. C. A 72-year-old post-op patient with a blood pressure of 88/50 mmHg. D. A 30-year-old with a fever of 100.4 degrees Fahrenheit, 38 degrees Celsius. Answer. C. A 72-year-old post-op patient with a blood pressure of 88/50 mmHg. Question 2. Which task can the RN delegate to an experienced LPN? A. Developing a care plan for a newly admitted patient. B. Evaluating a patient's response to 4 pain medication. C. Administering subcutaneous heparin to a stable patient. D. Teaching a patient about post-op wound care. Answer. C. Administering subcutaneous heparin to a stable patient. Question 3. A nurse finds a patient lying on the floor in the hospital room. What is the priority action? A. Assist the patient back to bed. B. Call the healthcare provider immediately. C. Assess the patient for injuries. D. Document the fall in the patient's chart. Answer. C. Assess the patient for injuries. Question 4. The charge nurse is assigning patients. Which patient should be assigned to the most experienced nurse? A. A stable post-op patient recovering from appendectomy. B. A newly admitted patient with suspected sepsis. C. A patient requesting discharge instructions. D. A patient scheduled for a routine colonoscopy. Answer. B. A newly admitted patient with suspected sepsis. Question 5. A nurse observes a CNA repositioning a patient incorrectly. What should the nurse do first? A. Report the incident to the charge nurse. B. Immediately intervene and correct the CNA's technique. C. Document the incident and notify management. D. Offer to provide education at a later time. Answer. B. Immediately intervene and correct the CNA's technique. Question 6. A nurse is preparing to administer medication to a patient. Which action is the priority? A. Verifying the patient's allergies. B. Educating the patient about side effects. C. Checking the patient's pain level. D. Ensuring the patient has eaten. Answer. A. Verifying the patient's allergies. Question 7. A nurse witnesses a colleague failing to wash hands before patient contact. What is the appropriate action? A. Ignore the situation as the patient appears stable. B. Report the nurse to the nursing supervisor immediately. C. Remind the colleague about proper hand hygiene. D. Ask another nurse for advice before acting. Answer. C. Remind the colleague about proper hand hygiene. Question 8. A patient is on contact precautions. Which action by the nurse requires intervention? A. Wearing gloves when entering the room. B. Removing PPE before leaving the room. C. Using alcohol-based sanitizer after glove removal. D. Placing the patient in a private room. Answer. B. Removing PPE before leaving the room. Question 9. A nurse is caring for a patient receiving a blood transfusion. What is the priority assessment? A. Checking for urine output changes. B. Monitoring for signs of an allergic reaction. C. Assessing for signs of hyperkalemia. D. Noting an increase in hemoglobin levels. Answer. B. Monitoring for signs of an allergic reaction. Question 10. Which task is appropriate for a registered nurse to delegate to a CNA? A. Assessing a patient's lung sounds. B. Educating a patient about a new diagnosis. C. Assisting a patient with oral hygiene. D. Administering oral medication. Answer. C. Assisting a patient with oral hygiene. Question 11. A nurse notices a frayed electrical cord in a patient's room. What is the best action? A. Unplug the equipment and report it. B. Continue using it until maintenance arrives. C. Tape the cord and monitor for issues. D. Ask the patient if they have noticed problems. Answer. A. Unplug the equipment and report it. Question 12. A patient has a latex allergy. What item should the nurse remove from the room? A. A blood pressure cuff. B. An oxygen saturation probe. C. Rubber tourniquet. D. A plastic medication cup. Answer: C. Rubber tourniquet. Question 13. A nurse receives a report on 4 patients. Which patient should be assessed first? A. A post-op patient with pain rated 7 out of 10. B. A patient with COPD and O2 sat of 89%. C. A patient with a potassium level of 3.5 milliequivalent/L. D. A diabetic patient with blood glucose of 80 milligrams per deciliter. Answer: B. A patient with COPD and O2 sat of 89%. Question 14. Which situation requires the most immediate intervention? A. A patient with a blood glucose of 150 milligrams per deciliter. B. A patient reporting severe chest pain. C. A patient scheduled for physical therapy. D. A patient receiving discharge instructions. Answer: B. A patient reporting severe chest pain. Question 15. A nurse is administering medication through an NG tube. What is the priority action? A. Checking tube placement before administration. B. Flushing the tube after administration. C. Administering all medications at once. D. Checking residual volume after medication. Answer: A. Checking tube placement before administration. Question 16. Which task is appropriate to delegate to an LPN? A. Administering 4 push medications. B. Evaluating the effectiveness of a new medication. C. Performing wound care for a stable patient. D. Developing a discharge plan. Answer: C. Performing wound care for a stable patient. Question 17. What is the best intervention to prevent falls in hospitalized patients? A. Keeping bed rails down for easy access. B. Placing the call light within reach. C. Allowing the patient to walk independently. D. Encouraging minimal fluid intake to avoid bathroom trips. Answer: B. Placing the call light within reach. Question 18. A nurse is verifying a patient's identity before medication administration. What is the best method? A. Asking the patient to state their name and date of birth. B. Checking the room number on the chart. C. Looking at the patient's wristband only. D. Asking a family member for verification. Answer: A. Asking the patient to state their name and date of birth. Question 19. A nurse is teaching about infection control. Which statement indicates a need for further teaching? A. I will use alcohol-based sanitizer after removing gloves. B. I will wear gloves when assisting with oral care. C. I don't need to wash my hands if I wear gloves. D. I will wear a gown when caring for a patient with C. difficile. Answer: C. I don't need to wash my hands if I wear gloves. Question 20. Which action ensures patient safety when administering medication? A. Relying on the pharmacy label for accuracy. B. Performing the 5 rights of medication administration. C. Giving medication before verifying the order. D. Administering all medications at the same time. Answer: B. Performing the 5 rights of medication administration. Question 21. A nurse is preparing to administer insulin to a patient with diabetes. What is the priority action? A. Checking the patient's blood glucose level. B. Administering the insulin before breakfast. C. Warming the insulin to room temperature. D. Shaking the vial to mix the insulin. Answer: A. Checking the patient's blood glucose level. Question 22. A nurse is caring for a patient with a new tracheostomy. What is the priority assessment? A. Checking for excessive secretions. B. Monitoring for signs of airway obstruction. C. Assessing for difficulty swallowing. D. Evaluating the need for suctioning. Answer: B. Monitoring for signs of airway obstruction. Question 23. A patient on oxygen therapy is complaining of dryness in the nasal passages. What is the best intervention? A. Increasing the oxygen flow rate. B. Applying petroleum jelly to the nostrils. C. Adding a humidifier to the oxygen setup. D. Encouraging the patient to drink less fluid. Answer: C. Adding a humidifier to the oxygen setup. Question 24. Which action by a newly hired nurse requires immediate correction? A. Using a gait belt to assist a patient with ambulation. B. Storing a medication cup in the patient's bedside drawer. C. Labeling a dressing change tray before leaving the room. D. Washing hands before entering a patient's room. Answer. B. Storing a medication cup in the patient's bedside drawer. Question 25. A nurse is preparing to administer a high-alert medication. What is the best safety measure? A. Administering the medication without delay. B. Checking the patient's identity once. C. Having another nurse independently verify the dose. D. Asking the patient if they have taken this medication before. Answer. C. Having another nurse independently verify the dose. Question 26. A nurse is transferring a patient from bed to wheelchair. What is the safest technique? A. Placing the wheelchair on the patient's weaker side. B. Locking the wheelchair brakes before transfer. C. Instructing the patient to hold onto the nurse's neck. D. Lifting the patient without assistive devices. Answer. B. Locking the wheelchair brakes before transfer. Question 27. A patient is receiving continuous 4 fluids. What is the nurse's priority assessment? A. Checking for fluid overload. B. Assessing for dehydration. C. Evaluating for electrolyte imbalances. D. Monitoring blood pressure trends. Answer. A. Checking for fluid overload. Question 28. A nurse is reviewing fire safety protocols. Which action is the priority during a fire? A. Extinguishing the fire first. B. Rescuing patients in immediate danger. C. Activating the fire alarm after exiting the unit. D. Closing all patient doors and windows. Answer. B. Rescuing patients in immediate danger. Question 29. A patient on bed rest is at risk for deep vein thrombosis, DVT. What is the best intervention? A. Encouraging frequent foot exercises. B. Lowering the patient's legs below heart level. C. Applying cold compresses to the lower extremities. D. Limiting fluid intake to reduce swelling. Answer. A. Encouraging frequent foot exercises. Question 30. A nurse observes a CNA disconnecting a patient's oxygen for transport. What is the appropriate response? A. Allow the CNA to proceed as long as transport is quick. B. Instruct the CNA to use a portable oxygen tank. C. Inform the charge nurse about the CNA's mistake. D. Reconnect the oxygen after the patient returns. Answer. B. Instruct the CNA to use a portable oxygen tank. Question 31. A nurse receives a verbal order for a high-risk medication. What is the best action? A. Write the order and administer the medication. B. Request that the provider enter the order electronically. C. Administer the medication first, then document it later. D. Ask another nurse to confirm the verbal order. Answer. B. Request that the provider enter the order electronically. Question 32. A nurse enters a patient's room and notices a small fire in a trash can. What is the first action? A. Use a fire extinguisher to put out the fire. B. Remove the patient from the room. C. Activate the fire alarm. D. Close the door to contain the fire. Answer. B. Remove the patient from the room. Question 33. A nurse is reinforcing fall prevention education. Which statement by the patient requires further teaching? A. I should wear non-slip socks when walking. B. I will call for help before getting out of bed. C. I can use the bedside table for support when standing. D. I should use my walker even for short distances. Answer. C. I can use the bedside table for support when standing. Question 34. A nurse is caring for a patient with a wrist restraint. What is the priority action? A. Document the restraint application every 8 hours. B. Assess the patient's skin integrity frequently. C. Keep the restraint in place at all times. D. Secure the restraint to the bedside rail. Answer. B. Assess the patient's skin integrity frequently. Question 35. A nurse is reviewing safety procedures for patients at risk for seizures. What is the best intervention? A. Placing the bed in the highest position. B. keeping suction equipment at the bedside. C. Administering seizure medication immediately. D. Restraining the patient to prevent injury. Answer: B. Keeping suction equipment at the bedside. Question 36. A nurse notices that a patient's foresight is red and swollen. What is the best action? A. Slowing the 4 infusion rate. B. Removing the 4 and restarting at a new site. C. Elevating the patient's arm above heart level. D. Applying cold compresses to the site. Answer: B. Removing the 4 and restarting at a new site. Question 37. A nurse enters a patient's room and finds them on the floor. What should the nurse do first? A. Assist the patient back to bed immediately. B. Notify the healthcare provider. C. Assess the patient for injuries before moving them. D. Document the incident and inform risk management. Answer: C. Assess the patient for injuries before moving them. Question 38. A nurse is teaching a new CNA about standard precautions. Which statement indicates understanding? A. I should wear gloves when handling bodily fluids. B. I can recap needles carefully before disposal. C. I should use alcohol-based sanitizer after caring for AC difficile patient. D. I don't need to wear a mask when suctioning a patient. Answer: A. I should wear gloves when handling bodily fluids. Question 39. A nurse is preparing to administer digoxin. What is the priority assessment? A. Checking the patient's potassium level. B. Monitoring the patient's blood pressure. C. Assessing the patient's respiratory rate. D. Measuring the patient's urine output. Answer: A. Checking the patient's potassium level. Question 40. A nurse is preparing to move a patient up in bed. What is the best action to prevent injury? A. Asking the patient to assist if possible. B. Lifting the patient using only upper body strength. C. Keeping legs straight while pulling the patient up. D. Using a single nurse approach for efficiency. Answer: A. Asking the patient to assist if possible. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.